Confirmed coronavirus cases now top 8,000 here in Florida. The Department of Health released new numbers late this morning. The state is also reporting 27 new deaths since 6 o'clock last night. Hillsborough County is now up to 372 confirmed cases, and that's the highest total in the Bay Area. We know so many of you have questions right now, so we are going to the experts for answers. Joining us right now is Dr. Lockwood. He's the Senior Vice President of USF Health and the Dean of the USF Health Morsani College of Medicine. Doctor, thank you so much for joining us. I know you are so busy right now, but we have a lot of questions we're hoping you can help us answer. A lot of medical experts, including you, are saying that you need to assume that everyone is infected. And this may be a hard idea to grasp, especially if you're someone who is following those social distancing guidelines to a T. So why is this so imperative?
Well, so the test we use currently to identify patients that are infected is an RNA test. It's what we call a nucleic acid test. And it only detects patients that are actively infected. So they have to be shedding the virus. And it's not the most sensitive test. So there's still a fair number of patients who test negative who are still infected. And that's probably about 30%. And it has to do with the way we extract the virus from the nose and the mouth when we do the swab and so forth. Secondly, we're only testing the sickest patients, right? We're telling people to come in if they're older and have comorbidities, they have diabetes or heart disease or lung disease, or they're hospitalized. So we're not telling folks that are mildly symptomatic to come in. And then a lot of folks are infected and never show any symptoms. We're now reporting that to be about 25% of folks in the United States, but it's probably much higher. In Iceland, where they did much more aggressive testing, it was about 50%. And we think in China, it may have been as high as 86%. So probably half of patients we don't even know are infected. Now, it turns out they're less infectious. They have about half the rate of conducting the infection to other folks, but they still can infect people. So you have to assume everybody's infected, keep social distancing. If you want to wear a mask in public, do that. Wear a bandana, whatever you want. Wash your hands frequently, but assume every surface you touch in public is infected and everybody you meet in public is infected. And if you do that, you'll lower your own risk dramatically.
And also, I was reading an editorial piece that you wrote that I would love for you to kind of break down for us, because you were saying that a major issue is we don't know how many people are infected, and a lot of it has to do with a certain type of testing that's not happening. So can you break that down for us and explain why it's so crucial?
So again, we're testing for the virus. We're testing for the viral RNA, and that means you have to be actively infected. But we're not using the normal test we would use in most other epidemics, which is to see whether or not you have antibodies to the virus. If you have antibodies to the virus, and particularly if you have enough antibodies and the right types of antibodies, what we call IgG antibodies, then you very likely have cleared the virus. If you're producing large quantities of antibodies, you've got about a 99.9% chance of not having the virus anymore. So you're not infected and you won't be infected. And those are the folks that can go back to work first. So as we begin to strategize about how we get out of this epidemic and how we go back to work, the first tranche of folks that can go back to work are the people that are immune. They had the infection, they probably didn't even know they had the infection, or they were very mildly affected, and then we now confirm they have antibodies and they can go back to work. And so that's a critical piece of information that we need to know, because we clearly have a lot more people that are infected than we currently can estimate. And identifying that population, confirming that they're free of the virus, getting them back to work will be a critical part of how the economy starts to revive.
And that's something that we all hope will happen sooner rather than later. And we've all been, practicing the safer at home orders here in Hillsborough and Pinellas for about a week now, but the entire state doesn't actually start until 12:01 a.m. Friday. So what do you think about the governor waiting to issue this order?
Well, I think I'm glad he did. I think it's critically important that we now lock down the whole state. But I am reassured by the fact that the counties with the highest level of viral activity, so Miami-Dade, Broward, Palm Beach, Lee, certainly Hillsborough, Pinellas, Orange County, have all had lockdown orders. So we've all pretty much been locked down for about a week. We need, at a minimum to be locked down for 2 weeks to break the chain of infection, and ideally a month. And so, I think it's an important thing that the governor has done. I congratulate him for it. But hopefully, we've already taken the critical steps in the most vulnerable areas, and those steps, have been in place for a while now.
And also, you did touch on this just a moment ago, but masks are a huge talker right now. Who should wear them, if we should all be wearing them when we're going out? The U.S. Surgeon General spoke about it again yesterday. The CDC may be changing their recommendations. What are your specific thoughts on that?
Most important thing is hand washing, hand washing, hand washing, hand washing, as often as you can with soap and water for 20 seconds. So sing happy birthday to me twice. That's 20 seconds. That's the single most important thing you can do. Assume all surfaces in public are contaminated. So use hand sanitizer if you're out and about and you can't wash your hands. But the covering your face is important. Not so much because it's going to protect you from being infected, but it's going to protect other people in case you're infected and don't know it. And remember, half of infections probably are undocumented. The patients don't have any symptoms, or they have minimal symptoms. So it I think, is a really good strategy for avoiding and breaking the chain of infection and reducing the number of folks that infected people come into contact with. Now, we don't have enough face masks, surgical face masks, so you can actually put a bandana on like you would at Gasparilla, except move it up over your nose. If you do have a surgical mask, use it. We don't want to encourage that because we don't have enough, and we're constantly trying to, from the healthcare perspective, we're constantly trying to save our personal protective equipment, our PPE, including our face masks. And a lot of what I've been doing the last couple of weeks is being the Radar O'Reilly of USF Health to assemble as much PPE as I can for my docs. And we have about a 3-week supply, so we really want to conserve it. But if you have a bandana, put that around. You may look silly, but you may be saving a life, and I think it is a good idea. I fully support the Surgeon General's idea, and I think the CDC is probably pretty close to recommending it as well. But most importantly, wash your hands, wash your hands, wash your hands, and assume that every surface is contaminated.
Not going to lie, I don't want to put my hands on anything right now thinking about that. It's crazy to think how many people could, be infected and just not know it. And not to get ahead of ourselves here, but there's a lot of talk about resurgence in the fall, and I know that has a lot of people pretty concerned. So is this something we're going to have to come to expect every year?
Well, yes and no. I think that it's likely that we will see a resurgence. I expect that as we get into the summer months, because of ultraviolet light, because of the heat and humidity, the virus will begin to be less contagious. It will spread at a much slower rate. And that's something that's been observed with coronaviruses and influenza and other viruses. So we do anticipate that. It certainly seems that the infection in China occurred within a very narrow latitude band of, kind of colder areas, and not in more southern and more humid areas of China. So there's the anticipation that we'll get better in summer, but of course, South America and Africa are going to go into their winter seasons, and the virus will pick up activity there. Then as we go back into our cold season, and it'll start to come back into North America. Now, hopefully we'll be ready for it with all kinds of tests, much better testing, much more available testing, much better public health, contact sourcing, contact tracing, isolation of the patients. And we are, I think, on the verge of having a whole battery of different drugs that are going to be effective. Increasing evidence looks like chloroquine may work. There are a number of really interesting drugs that are antiviral that seem to be very effective, and we're in the midst of clinical trials. Some of those are occurring right now at Tampa General with our docs, and hopefully they'll be beneficial as well. We're also beginning to use convalescent plasma This is something we're also starting up at Tampa General to be able to treat patients that are acutely ill. So I think in the fall we'll have a lot better handle on identifying cases and isolating them to prevent the spread of the infection. We'll have much better medications. So I'm not nervous about the fall. I'm anticipating this. If it doesn't happen, great. If it does, I think we'll be ready for it. By early winter, we hope to have a vaccine. And hopefully, once that vaccine is available, everybody will take advantage of it, like they should be taking advantage of the influenza vaccine. And shame on everybody if they haven't had their influenza vaccine. And then I expect that if it does recur in future years, it'll be really much less significant, much less severe. There'll be much more herd immunity, much less spread, and eventually, it'll become more like the flu, or maybe even less common than the flu.
Well, that's definitely a good thing. Encouraging words there, Doctor. Now, Dr. Lockwood, last question for you. When do you think this will peak here in the state of Florida?
So we have pretty good modeling. Our College of Public Health has excellent modeling now for Hillsborough County, and the peak is expected around May 2nd. May occur a little bit sooner than that, but based on our current trends, particularly in Hillsborough County, we think we'll be in pretty good shape. The rate of increase in Hillsborough has not been remotely similar to what's happened in places like New York. And we believe that it will not overwhelm the number of beds and ICUs and ventilators that we have. And so that curve, we think, is being flattened and will continue to be flattened. Now, having said that, it is absolutely critical that we maintain social distancing, that people wash their hands in public, wash their hands when they're out in public, use hand sanitizer, cover your face if you can, because that's why we're seeing these good numbers. And I think kudos to the mayor and our county commissioners for implementing our stay-at-home policies early enough that we, I think, are going to be in pretty good shape. Now, a lot of assumptions there, but the most important assumption is that your viewers stay at home as much as is humanly possible, and don't go out and spread the virus. But if we do that, and if we can maintain that level of social distancing, hand washing, covering up, I think Hillsborough County should be in pretty good shape through the peak. And then obviously after May 2nd, we expect that things will get better and better and better. And again, people that are immune can start going back to work. And then as the R value, the number that everybody talks about as an indicator of infectiousness, as that drops less than 1, when one person doesn't even infect one person, then the non-immune healthy folks can go back. And then finally, in a few more weeks or a month after that, the more vulnerable folks can go back. So, we definitely see the light at the end of the tunnel in Hillsborough. I'm still worried about Miami-Dade, Broward, and Palm Beach, particularly Miami and Broward. But I think we probably will be able to avoid any kind of catastrophic overburdening of the hospitals in Hillsborough County if we can just keep everybody at home.
Very glad to hear that, Doctor. Thank you so much. We have another rough month ahead, but like the doctor just said, there is a light at the end of the tunnel. We appreciate all of your insight and you joining us. Thanks so much.